Okay, so one of the most common questions that I get asked is, Mike, what can I do for my tight hip flexors? Now the question should actually be, Mike, why do I have tight hip flexors and what can I do about it? And the first thing we need to figure out is, first of all, are you just perceiving your hip flexors as tight? And we're gonna go over a test that will help you with that. How can I get them stronger? Because most hip flexors actually responsively tighten up because we keep them shortened and unused all day, therefore they get weak. And then how can I stretch them out after to help them relieve some of the tension and the pain associated with that? So today we're gonna go over the test, some strength work for your hip flexors, and a couple stretches to help you relieve your discomfort. So we're gonna go over a Thomas test. It's a really down and dirty test to see if any one or all of your hip flexors are tight. We can't parse out which one it is, but we can say, okay, you have some general tightness in the flexors or flexor of your hip. So all you're gonna do is you're gonna sit on the edge of your bed, you're gonna grab your knee, pull it up all the way into your chest, and you're gonna lean back. And all we're looking for is your knee above your hip joint, and it would look something like this if it were. You say, okay, so that's a positive Thomas test for our hip flexors. Tells us if the structures of the muscles in the front of our hip are tight. It's pretty simple, pretty basic, but it can lead you to say, okay, now that we know that there's tightness there, what can we do about it? Well, chances are we're gonna have to strengthen your hip flexors a little bit. That's right, we're gonna have to use them and then stretch them. Chances are we need to strengthen your hip flexors if they are tight, or use them. Maybe not strengthen them right away with, you know, loaded plate, knee to chest, that kind of stuff, but more like rubber bands, isometrics, things that get them to turn on and turn off. Because as we sit in a shortened position all day, our hip flexors stay really short. So we need to tell them when to turn on, when to turn off. And a great way to do that is just simple isometrics. So laying on your back, and all you're doing is pushing your hand and your knee into each other for 5 seconds, and then relaxing. And we're gonna do 5 reps of these. And you wanna make sure that your knee is at or above your hip joint as you do these. That'll make sure that you get more iliopsoas recruitment.